Hi, and welcome to the second video, how to build your resource list. We're going to go over how to build a list and create working relationships. I like to start with the places that I'm going to be referring to or that I might need to refer to. It all depends on your organization. Best practice is to ask coworkers and use Google just in case. You'll be referring to MOUD medications such as buprenorphine or methadone, inpatient and outpatient treatments, withdrawal management and detoxes. You can even refer to Recovery Cafe, or a great resource is Peer Spokane or Peer Seattle. You'll also be referring to shelters or mental health providers. Again, it all depends on your organization. How to build a list and create working relationships. I like to call or email places and make an introduction of who I am and where I'm working. Set up times to call them or to meet them in person. It forms real working relationships. What I figured out when I first started is it's hard to refer a patient somewhere I have never been. This way I can tell them with confidence about the place that I'm referring them. With time, you will have return patients who can give you a review of the eyes of somebody who is using the service. But when you start, it's best to have a personal connection before you refer. Patients can tell when you really believe in the place you're referring to, and they'll be more likely to go if you already have a relationship with that organization. With a personal relationship, you'll also feel more confident in where you're helping the patient, and they'll have confidence in you. When able, warm handoffs are always best if you're able and your organization allows it. You and your patient build trust, so a warm handoff can actually lead to a higher engagement. It's hard for someone starting out to actually walk into a place, and if they have a familiar face, they will be more successful and more likely to show up. What are the treatment options in your area? Having as many options for your patients can help them be more successful in their idea of what they want. Remember, this isn't a one-size-fits-all. What works for some may not always work for another, whether that's inpatient, detox, withdrawal management, or outpatient. Some may work for some and some may work for others. It all depends on their situation. SUD assessments most of the time need to be scheduled. There are some places that offer walk-ins. To be in treatment, most of them require assessments prior to being admitted. Part of a care navigator is understanding that the moment goes by fast, and the more resources you have, the more you're going to be able to help the person you're working with. The ASAM and SUD assessment is always on a if needed basis. It is done with an SUDP, a substance use disorder professional who does treatment assessments. Make sure you stay in regular contact with the places that do the assessments so your patient can get into one as soon as possible. I always find that that window of wanting to get an assessment can change very quickly. Patients need to have a current assessment to qualify for treatment. Some won't qualify for the inpatient treatment. Find a program or shelter that doesn't classify as an inpatient facility for these cases. Assessments can last for 1 year, and they need to be revised to get into treatment if the period has been too long. Waiting for treatment? What if there isn't space? Sometimes a detox bed might not be available. In that case, find your patient a safe spot while they wait for treatment. Sometimes that may be a shelter bed. You can connect them with family members, friends, or loved ones, or another safe place they can stay until they are able to get into a detox or withdrawal management. Some additional resources are the Washington State Opioid Treatment Program 2022 Guide, the Overdose Outreach, Education, and Training Resources for King County. There's on-demand training through the Bridge program in California, Medications for Substance Use Disorders Training Guide, SAMHSA. ADAI resources. ADAI has a homepage, learnaboutTreatment.org, stopoverdose.org, Transforming Our Communities, ADAI Publications and Reports, and the Washington Data and Statistics. Thank you for watching, and as always, please feel free to reach out to me if you have any questions or you would like any additional training and advice.